There's been too many people that have gotten sick from contaminated dental unit water lines.
Simplicity isn't always the trump card here. There is actually complexity to this.
You're right, shocking is time consuming and you really have to do it right.
You have a really good analogy of how to see shocking and treating harmoniously.
So shocking is like me going in to see my dentist, my hygienist. They can do things that I can't do on my own. That's shocking.
Kellie Thimmes is an expert in water science and waterline compliance. She has over a decade of experience educating the industry and has helped over 12,000 dental practices achieve safe water. She has led the way in shaping the standard for waterline maintenance and has consulted some of the nation's largest DSOs in helping them elevate their infection control standards. Kellie's passion and knowledge of waterlines is unmatched in the industry.
If a customer would call and say, I was told that I just put this on, that's all I need to do, and it's just not true. That's just not the case.
Kellie, why is waterline maintenance so important?
It may be a small part of infection control, but it is a critical part of infection control nonetheless. There's been too many people that have gotten sick from contaminated dental unit water lines. Both the patients, of course, that we know so well about, but also dental professionals. They're breathing in those aerosols. And so we need to make sure that they're maintained.
Yeah. And let's start with back to the basics. For people that are potentially listening in that might not know this area, because you did mention it is kind of a smaller part of infection control, super important and critical. But to those that might not be super familiar, help educate us on what is waterline maintenance and the best practice standard.
Right, so let's back it up to what water lines we're talking about first and foremost, right? Because that gets confusing. Even when we could do a whole webinar on water lines and it's like, there's still some confusion at the end of the call.
Totally.
So the water lines that we are so passionate about are the water that's going into your patient's mouths, right? So the air water syringe line, your handpiece line, your scalar lines, anything that's gonna be putting water into your patient's mouths. Those are what we need to, that's what we are professionals at. That's what we need to maintain. And it takes work. It takes adding a shock treatment to the water bottles. It takes using a water bottle in the first place.
There you go. Gotta start with that first.
It takes knowing the source water that you're using. It takes, again, shocking, treating, and then, of course, testing to make sure that everything is good. And it sounds simple, but each one of those steps it's important to kind of drill down into.
One, I love that you call that out too, because I think simplicity isn't always the trump card here. There is actually complexity to this. Everybody's dental environment is a little different, and so is their water. It's also a little different. And so there's specificity when you get to. So let's get into it. Let's start with shocking first. So it sounds like there's shocking, there's treating, and there's testing. So let's talk about shocking first. How do I know how to shock? How do I know what I should be shocking with? Help me understand some of the basics in order to do the first step really well.
That's a good point. So shocking is using a strong chemical that we're going to put into our water bottle, and we're going to run that through the lines because it's going to kill, so then we can then remove any bacteria or biofilm from the water lines. And it takes using a strong chemical, which it's hard to say, but it's just true. We can't get into the tiny little lines with a scrub brush and scrub it, right? So we have to rely on a strong chemical to really get in there and break it up. And there's pictures of biofilm. It's thick, it's sticky, and so it takes something really strong to be able to break it up and remove it. And so there's a lot of shock products on the market. Waterlines is a hot topic, and so even more products are kind of coming out. But thankfully, we have a huge lab where we're able to do a lot of testing, so we know which products are really which work better. And it takes something strong. So we even recommend a diluted bleach solution. It's just important that you're following instructions and not leaving it too long. And that's with any of the products out there. You have to follow the instructions and make sure that you're doing it right, because that all plays a part into it. But there's a lot of good shock products. We recommend, again, diluted bleach, Liquid Ultra. It's a Crosstex product. 3D sells it now.
The pink stuff.
The pink stuff. Think pink once a week. We used to be called, but they've made some changes to the instructions where you can use it with other products. But it's really effective at removing that biofilm.
That's interesting that you pointed out the once a week thing, because it used to be most shock products, that was their IFUs, is you would shock every week, which is when we look at the data in terms of what is the most frustrating step, shocking by 80%.
Really?
Yeah. It's the most frustrating step because it's so time consuming, like you said. It takes a lot. It takes a lot of effort.
Yeah.
And so being able to do that a little less frequently, is really nice. But the only reason why you're able to do it less frequently is because of step number 2, which is treating. So tell me a little bit about that and the relationship. I think sometimes that's difficult too. So now you have 2 things you're putting in your water lines. You have a treatment, you have a shock. How do those work together to create an effective protocol?
Yeah, so step 2 would be the treating. So using a low-level antimicrobial, a tablet or a straw, or there's some liquids out there that you're going to add to your water bottles, whether that's a tablet that you're adding every time you fill up the bottle or maybe a straw that's connected to your unit. It's adding that low-level antimicrobial. So then you can push out that shocking a longer period of time. Because you're right, shocking is time-consuming.
Yes, it is.
And you really have to do it right.
Yeah.
But it's necessary. No matter what maintenance product that you're using, shocking is going to be it's going to be necessary.
You have a really good analogy of like how to see shocking and treating harmoniously. Yeah. And that's like the whole dental
professional. And I don't have a dental clinical background, but I do have like a nursing background. So, but similar. So shocking is like me going in to see my dentist, my hygienist, for that professional appointment. Yeah. They can do things that I can't do on my own. They can see things that I can't see. Maybe there's areas where you need to watch or whatever that looks like. That's shocking. That's going in for my twice a year appointment. Yeah. But the rest of the time, they would never tell me, okay, you're good to go for 6 months. You don't have to do anything. I have to do my part, right? I have to do my daily brushing and flossing. Totally. And that's like treating. That's using that low-level antimicrobial. That's not doing what they can do, but it's doing my part to make sure that I'm keeping up with my oral health. Same thing with your water.
Allows you to spend less frequent times in the chair, so to speak. Yes. Right? It's like you should be going every 6 months as opposed to maybe every month or every week. Right. If like the regular treatment wasn't being upheld, you would probably have to go very frequently. Totally. Right? Because plaque and buildup happens so fast. Yeah. But because of technology today with being able to floss and be able to brush daily, now that time can be elongated, even though you absolutely should still go get a professional cleaning.
Like
if
you
I
still
don't do have
my
to
part,
go do that.
Yeah,
totally. And I think that's important to know because that is actually a really good correlation. There are people that might believe that I can just use a straw and then I'm done. Yes. Or a tablet, then I'm done.
And it used to be, I would say like even like 5 years ago, it used to be, it's getting better now, but still somewhat is, there used to be this, you put this on, it's a one and done type of thing, this magic bullet, so to say. Bullet. And it's just not the case with Waterlines. If a customer would call and say, I was told that I just put this on, that's all I need to do for a year. And it's just not true. That's just not the case. No matter what product it is, it's going to take some sort of effort routinely. Yeah. Daily.
And they're for different purposes. Totally. Yeah, it's like a low-level microbial. Yeah. It's like it's only going to be able to do so much because it's safe for patients to consume. Whereas the shock, not so much. Right. But it cleans them out and sets it back to like ground zero. Yeah. Okay, so we have the shock, which is critical. It's kind of your baseline. Yes. You have your treatment, which is more really a kind of like a convenience thing. It gives you that quick drop that keeps your patient safe, keeps you safe, but lets it kind of go longer between shock cycles. And then there's testing, which really in the industry is the area that's probably the least known about or at least followed. Yeah. Right? I feel like most offices you go in, you probably maybe see a tablet or a straw, and there's some kind of cadence in which they might shock. But testing really still is a growing conversation. Right. Why is that important? And then what does that practically look like in this 3-step timeline?
Yeah, you're so right. I think there's still so many offices that never even heard of testing. Maybe they've heard of adding a tablet or they're doing some part of it. But usually it's the shocking and then the testing that gets kind of skimped out on. And so testing is really going to prove that what they're doing is working. It's going to prove that they're compliant. It's also going to prove that the products that they're spending money on is working, that the protocol is effective, and that they're not doing it for nothing. But it also shows compliance. What do I need to do? Is my water safe? testing's the only way to really prove that it is.
Yeah. And there's multiple options to test. I think this category is growing.
Definitely growing.
Yeah.
Yeah.
And so there's more out there. And because it's growing, it's taking on kind of the spotlight, I would say, in the waterline maintenance conversation. More people are talking about testing than ever before. There's more products coming out than ever before on testing. So the space is getting a little bit more complicated. As a buyer, right, I'm looking at it and saying, okay, wait, there's actually way more here than maybe I initially thought. Help me kind of walk through what's available, maybe the pros and cons of each one. Yeah. Because there are a lot more coming up.
There are a lot of tests that came out. And so and I get it, right? That people want to have choices. They want to have things that they can choose. But sometimes the newest to the market isn't always the best, right? Or the fastest to the market maybe isn't always the best. I think every test that's out there has its role. I mean, they can all be useful. But yeah, they're all going to be a little bit different. So there's mail-in testing. There's labs all throughout the nation. But there's mail-in testing that offer R2A testing, which is known as the gold standard for testing. Yeah. ProEdge does that, of course. And then there's other labs throughout the nation that do that as well. Yeah. There's a membrane filtration method that I believe Loma Linda University does. Also a great way to test. It's part of the EPA standardized method. Yeah, nice. Same as R2A. And then there's flow cytometry, which is really cool. It's a state-of-the-art way to test. R2A, the membrane filtration, good. You mail it in. It takes about a week, maybe a little bit longer with the membrane filtration to get your results. But you do get a precise CFU count. Where with flow, you get your results just way quicker. So you would overnight it to us. You get your results the same day we receive it. Yeah. And you're going to get also a CFU count, but it's going to give you a range that's going to be really helpful so you can take action right away. If there's failures, you can address it. If you passed, you're good. Yeah. But it's just really a quick turnaround.
Which I think is big, specifically if an office has any kind of closure procedure. Yes. Right? So you get a failure, that operatory is no longer in use until it remediates. R2A. Yeah. A gold standard, but it does take time to incubate.
Yeah, and I think it came out in like a long time ago. Sure. Long time ago. I don't know exactly when R2A. Dr. Shannon Mills was just talking about this, so I should know. Yeah. But a long time ago. Yeah. So we need something new. Love that flow. And R2A is still great, but flow is really just that state of art. It just really is a great way to test.
And it's still going through a lab.
Yes. Yes.
And then I know that there are now there's like more of the mail-in side of things. It's not necessarily a lab, it's more self-documentation. So walk me through that other side of testing.
Yeah, so there's paddle tests, there's in-office tests. So we have Quick Pass, of course. It's the only in-office paddle test. It is specific for dentistry, which is nice. And there's some red paddles that are different brands, also a good way to test. And with the paddle testing, it's also a heterotrophic plate count. So you're going to get a CFU count, which is good. So it's better than just a pass-fail type of test. Yeah. You can do it in the privacy of your office. It takes about 72 hours to get your test results back, but it takes about a minute and a half to do the test itself. To go into the operatory, take the sample, and then the waiting for the results is the longest part. Yeah. But it's still pretty quick, right? Yeah. You can do it on a Friday, get your results on a Monday. Yeah. And it's pretty accurate. With Quick Pass, if there's any bacterial, it'll just show up as red colonies. Easy to count, easy to document. Yeah. And then also the red paddle, again, it's going to give you a CFU count, colony forming unit count, which is helpful. There's some other tests that maybe it's a color change or just a pass-fail. Again, great, but they're more of like a screening type test. Okay. And so you want to know from a pass-fail standpoint, is it 501? Is it 800 CFUs? Is it 8,000 CFUs? Is it 80,000 CFUs? With the pass-fail, you're not going to know. So it's important.
Why is that important for me to know?
Yeah. I mean, a fail is a fail. Yeah. Right? But there is differences to the failures. Okay. And so how I would talk to customers if they failed at 800 CFUs would be a lot different in helping someone remediate at 80,000 CFUs. Okay, gotcha. So it's important to know, like, where am I at and having that CFU count.
Now, there's also a lot of talk in how you sample too, right? I think there's really two ways. There's pooled sampling, and then there's the individual samples. What does ProEdge recommend? What do you recommend? And kind of explain the differences to me too.
Yeah. So It's important to test every water line in your operatory, in your
okay.
whole office. It's important to test everything. But we also know that testing everything individually would cost a fortune.
Yes, it does.
Now, there may be times, rare times, that we would have to have you sample everything individually. But we did a lot of data, and we found that with pooled sampling or combining samples from the same operatory, so say I have vial 1, I'm going to go into operatory 1, and there's 2 air water syringes, a handpiece, and a scaler.
Okay.
I'm going to take equal amounts from each device that's in that operatory into one vial. And you want to get as equal amounts as possible.
Sure.
Do the best that you can. It doesn't have to be perfect, but just do the best you can.
Okay.
And then we're going to get a good idea of what's going on in all the lines.
Gotcha.
And it's very rare that you'll have a false negative. If there's bacteria in any of those lines, we're going to find it. And then we can help you. Now, we're not going to know exactly what line failed, but it doesn't really matter because we would have you shock everything anyway.
Right.
So if you tested operatory 1 all individually, the air water syringe passed, but maybe the handpiece and the scaler failed. We're still going to have you shock that air water syringe.
Right, yeah.
Or whatever lines.
There's not really an easy way just to shock that line anyway.
No.
You're going to shock everything. Yeah, good point.
Yeah. So it just makes sense, and it saves money. Now, again, maybe there's some rare times where we've tested and we're just getting repeat failures, and we have to kind of pinpoint what line it is, what's giving us the issue, maybe then, but very rare does that happen.
Yeah. Let's get into that a little bit, because I know for some it could be frustrating to get into testing thinking that you're doing the right things and then getting a failed result. Like anytime you're getting a failed result on anything, let alone just water lines, it's like, it's disheartening.
It's scary.
Yeah. And so a little bit about what do I do if I do fail? Because I think that kind of plays back into like step 1, step 2 type stuff. And then if I'm getting repeat failures, what should I be doing? What should I be looking for?
It's so true. And I think that just talking to dental professionals, we were just at Chicago Midwinter and talking to dental professionals, I think it is the fear of failing is what's keeping a lot of people from testing at all. And so I love that they're bringing that up, though, and talking about it, because it's so true. Because I think they think, well, if I fail, what am I going to do? How long has it been like this? How much is it going to cost to fix whatever is going on? And so just at least vocalizing that, like, this is causing anxiety to be able to just to test at all.
Yeah.
Love that there's so much information around waterline testing, but it can definitely be scary.
Yeah.
So if you do get a failure, I would always recommend reaching out for help because, at ProEdge for sure, we love helping people troubleshoot, figure out what's going on. We don't want you to wait until the 3rd failed test where you're like, oh my gosh, I don't know what to do. Or you've just gone in and invested all kinds of money in something that we would have been like, oh, maybe you could have just shocked with something stronger or whatever that looks like. So definitely reaching out for help.
Okay.
We'll walk you through what to do. Every office is going to be unique. So, what works for office A may be different than what works for office B. It's just different.
Yeah.
Because every office is different. And so it's really about digging into your own protocol. What is going on? What have you been doing? What's your source water? Just a bunch of different things that we can troubleshoot with you. And so you don't feel like you're alone doing it, and you have someone walking alongside you. And I also love too at ProEdge is that they're not going to just try to sell you some of our products or whatever. For number 1, we don't have a shock product yet. Hopefully that's coming.
Yeah.
But even if we did, if that wasn't what was going to work, we would recommend what did. And we study and research every single product on the market because we want to help dental professionals where they're at with what they're using and maybe just tweak up their protocol a little bit. But sometimes it's even looking past the shocking and seeing what's going on in the dental unit, maybe their source water, distilled water. Usually bottled distilled water is a good source, but it can actually grab bacteria quicker because there's nothing in it.
Yeah.
Especially if you're not adding a tablet to it. So if it's just sitting in the bottle. In-office distillers or filtration systems will often fail more than just tap water even, which is backwards to think about and to say.
Yeah.
But they do. And so it's just kind of looking at that. Maybe the filters need to be changed or the tank needs to be sanitized, something there. A dead leg. So slow speed lines are the biggest dead leg. And basically what that means is just there's empty tubing that there's not water in, or water can go in, but they're just not using it.
Yeah, right. Okay.
And so that water will kind of collect or sit in there and bacteria will start to grow and it will contaminate the rest of the unit.
Yeah. Wow.
Yeah.
Okay.
Yeah.
I want to talk more about source water in a second.
Yeah.
If I can recap, so if I fill a water test, it sounds like there's some shocking process I need to do. So
Yes.
walk me through that. So there's like shocking and then probably a retesting.
Yeah. So if you have a failed test result, we're going to have you shock.
Okay.
And depending on what you've been using, maybe that you never shocked, maybe just tested as a baseline test and you had some pretty high counts. Well, we're going to have you be pretty aggressive with the shock. So maybe that's using the diluted bleach solution or the Liquid Ultra, Crosstex's Liquid Ultra, both great protocols. But we are going to have you do that process 3 times. So it's, again, time consuming. Now, diluted bleach is just going to be 10 minutes, and then we're going to flush it out. And then we're going to do it again, 10 minutes, and we're going to flush it out. And then again, 10 minutes, and then flush it out.
Yeah.
And really focusing on that flushing out part is going to be key, especially when they have some high failures, because it tells us that there's a biofilm in the lines. And that flushing, or that fluid motion of flushing everything out will help push that bacteria, that biofilm out of the lines. And a lot of people, and I can see why, I've helped so many offices shock. I can see why you only flush for about 2 minutes or so, because it's like, that's good enough.
Yeah.
It's not good enough. You got to flush a full bottle of water through those lines to really flush that bleach out, the diluted bleach out, but also that bacteria. We're relying on that bleach to break it up, especially that biofilm. Well, we need to push it out of there.
Gotcha. Okay.
And so 10 minutes, flush, 10 minutes, so 3 times.
Yeah.
Same thing with the Liquid Ultra. It's 3 overnights, but you have to do that whole process 3 times and flushing it out the next morning.
That's a lot.
It's a lot. It's a lot. Yeah. So usually we can just be aggressive with the shocking, or maybe change up the shock product that was used. Maybe they're just using a weaker shock that's not really going to break up that biofilm good enough. So maybe just switching to something that's stronger. Even just switching up products in general can be helpful too, because bugs can get used to used to that product. Yeah. So maybe they've been shocking with diluted bleach. Well, let's try Liquid Ultra. Let's just kind of switch it up. Or maybe we've been shocking with Liquid Ultra. Let's try ICX Renew or diluted bleach. Something that's going to be a little bit different. Yeah.
And then what's the next step after that?
And then you want to retest.
Okay.
So we don't always want you to just shock and test every single time that you're testing, because we don't want to test your shock every single time. We want to test how your lines have been doing.
Gotcha.
But there are times where we've gotten a failing test result. We need to shock because there's a failure.
Totally.
And so we do need to test pretty quickly because we want to make sure that shock worked, shock was effective. But again, we don't want you to just shock test all throughout the year.
Okay.
But if you do have a failure, it is important to shock and then retest pretty quickly to show that it was working, that it worked.
Okay. Let's talk about source water real quick, and then let's put it all together, because it's like, even in my head right now, it's like, okay, when do I do what?
It's a lot,
Yeah, so we'll create some clarity there. Source water is an interesting one, because for the longest time, distilled water has always felt like it's the trump card for like, this is the best water to use. You were saying that might not be the case. And so tell me a little bit about what water should I be using in the Waterlines?
Yeah. So it's a common misconception that distilled water is the only thing that's needed. And so I think distilled water is fine. If they buy it commercially, I think is probably better. It's expensive, so it's definitely not going to be the first thing that we'd recommend. But I can see when people do want to use it. However, distilled water can be harsh on your equipment. It can become acidic when it's exposed to air. And so it can be corrosive on your equipment, and it can also leach out like the metals and plastics, and can cause some damage to your equipment. So like ADEC, and there's other manufacturers that just don't recommend distilled water. So tap water is really fine to use in most cities, in most areas. It's free, right? The EPA regulates the water at least coming into your building, so we know it's okay at least from a bacterial standpoint. Now maybe you have hard water in your area, or maybe it doesn't taste the best. If it's not super, super hard and it just doesn't taste the best, it's probably okay to use.
Okay.
But if it is super hard, maybe going to a bottled drinking water or purified water of some sort would be a better move than using that distilled water. Yeah. It's balanced in minerals.
Sure. Yeah.
Yeah.
Now, if I'm relying on tap water, there's the fear, and this doesn't happen very frequently, but
Mm-hmm.
we could get a boil water advisory,
Yes.
and of course that would make the tap water unusable.
Mm-hmm.
So then, are you recommending in that case just to go with bottled tap water?
Yep, bottled drinking water,
bottled
or
drinking
even
water,
bottled
sorry.
distilled water in that
Yeah.
case. That's where having a water bottle on your unit is so key too, because there's a difference, right?
yeah.
If you're filling up your bottle with tap water,
Yeah.
if there's a boil water advisor, we can just use bottled water. But if your lines are plumbed directly to the city line, there's no water bottle in that unit,
Right.
you have to shut down. And I don't really even know what they would do after that. Just flush it out, or
great
what?
call out.
Yeah.
That would be really frustrating.
Yeah. And so
Yeah.
CDC, ADS, formerly OSAP, they definitely recommend having those
Okay.
independent water bottles on your unit. You can gain control over the water quickly with that
That's
bottle.
it sounds
Yeah.
like having the ability to
Mhm.
change and shift is really important.
Yeah.
Yeah.
Key.
To keep operation up and going. That's great.
Yes.
Okay, so let's go back. If I was to plan out my year,
Mhm.
let's just say it's January, and I'm listening to this now, and I'm like, okay, I get it. Like, I want to understand how to do waterline compliance really well.
Mhm.
How would you advise me to put together a plan to do that for the whole year? When do I do certain things? When do I shock? When do I treat? When do I test?
Yeah.
Help me
Yeah,
understand how to do that.
that's a good question, and it's
Yeah.
hard to know. So I think the first step is, and that I commend all people on, is deciding that we are going to do some sort of treatment program. And so it's like that's the first step, is just getting started, understanding the different products that are out there. Right? Maybe we want to use a tablet instead of a straw treatment, or maybe we want the straw treatment instead of the tablet. And
Okay.
so both are good. Both come with pros and both come with cons. It just depends on the office's needs. A lot of people still like to drop a tablet in every time they refill their bottle.
Yeah.
Fine.
Cool.
Totally fine.
Yeah.
Some don't. They don't want to have to do that. They just want the straw treatment on there. They can refill their bottle and go. They're good to go. Fine. So I think it's deciding what product that you want to use, what treatment, how much water you go through, kind of planning that out. And then we would recommend maybe getting a baseline test. Let's see where you're at. So doing a test to begin with. And maybe a mail-in test or a quick pass or in-office test, whatever you want to do.
Sure.
But that's going to give us a good place to start. Chances are you're going to have some failures if you're just getting started. And that's okay. That's okay. So we would recommend testing, see where you're at, and then we're going to shock. We're going to do probably an aggressive shock when we're just getting started. So that 3 times that I was talking about earlier.
Gotcha.
And then we're going to start doing that daily tablet, or we're going to have that straw installed. So we're treating our lines in between. Now, after the shock, if we need to test again because we had some failures, we need to retest.
Sure. So that's the remediation thing.
Yes. Or maybe you just want to just start off with shocking, because we want to shock before starting a protocol. If we're ever switching from one product to another, of course, if we have a failure. And then we recommend as a best practice to shock every quarter.
Okay.
Once we get to a good
so that's good
point.
for my calendar planning.
Yes.
So if everything's going according to plan, I shock quarterly.
Yes.
Okay.
Yes.
Okay.
So shock. And so say we're going to shock on the first day of the quarter. We're going to start adding maybe a daily tablet. So every time we fill up our bottle, we're going to add a tablet in there. And then we're going to test on the last day of the quarter.
Okay.
And well, actually, if you're using an in-office test, you want to test monthly for a couple of months to get some passing results, just as you're just getting started. But if you're going to do a mail-in test, you can definitely do the just every quarter.
Yeah, gotcha.
So that'll give you, we shocked on the first day of the quarter. We're using our tablet in between. Every time we fill up our bottle, we're using a tablet. Last day of the quarter, we're going to test.
Okay.
If everything passed, we know our water's been safe that whole time.
Okay.
If we do that 4 times out of the year,
we're good to go.
We're good to go.
Okay.
Now, chances are we're going to have a failure in there somewhere just because it happens.
Yeah.
Maybe not. Maybe have a great protocol down. But failures happen from time to time for sure.
When you break it down quarter by quarter, it's not as scary.
Totally.
Because it's like I only need to shock once.
Mm-hmm.
I only need to test once.
Yes.
And then I'm doing the thing I was doing already, which is just dropping tablets into the bottle. I had to be consistent with it. I think that's important.
Making sure we're consistent. Yeah.
That feels less daunting than maybe how I'm initially perceiving getting into it. Because also when you get into it, there is a lot of getting it cleaned to have a great baseline. But definitely feels doable once you get into a rhythm.
It does. And if you think about it, and that's why we recommend the strong shock to begin with, because it takes a strong shock, especially just getting started. But if you're doing that shock 4 times a year, it's not super harsh on your equipment. it needs to happen. We need to be harsh with that bacteria because bacteria is strong. That biofilm is sticky and stubborn, hard to remove. And so it just makes sense to use a strong shock.
Yeah. Asking a few obscure questions that I know we get asked frequently here at ProEdge. When it comes to treatment, there's tablets and there's straws, but there's also the ingredient itself, which currently on the market is either silver or iodine.
Yes.
There's a lot of commotion or perceived commotion around the two.
Yeah.
What do we know? What do you know about really the differences between the two, and what do you recommend? Which one's better, so to speak?
Yeah, that's a great question, and such a question that we get a lot. And I think there's some misinformation too that just it stinks when that happens. But it is what it is. Both products work. There's the silver-based tablets. All the tablets are silver-based. They all work great. I mean, they're all good.
Yeah.
There's a couple of different straws. So Dentapure and Hufredi straws, Blue Tube. We all have the non-allergenic iodine.
Okay.
And it's non-allergenic iodine. It's resin beads. It's non-corrosive. It's safe to put in our patients' mouths, right? So it can't be super harsh. There's also a silver-based straw that's also just as good.
Okay.
But they all can also fail, and so it's just a matter of making sure that we're doing that daily flushing, that daily maintenance, and that we're keeping up on things, and just knowing that it's not a one and done type of thing. It's not drop in a tablet and I'm good for the year, or put on a straw and I'm good for the year. Totally. It takes effort no matter what product it is. Yeah.
I think the underlying, like the thing that really matters is consistency. Yes. It sounds like it's just like you can do a tablet, you can do a straw, you can do iodine, you can do silver. Yeah. And they're effective as long as you're actually using the product.
Right.
Yeah.
Yeah. I mean, if I didn't put a tablet in every time, the tablet's not going to be in there to work. Right. And just skipping out on one time can really make a difference. And so it's really important to do. And along with dropping a tablet, are we flushing our lines in between patients? That's really, really important. Are we flushing our lines at the beginning of the day? I know the CDC used to say 2 minutes in the morning. They don't really say that anymore, but it's definitely not going to hurt to keep the water flowing through the lines as much as possible. Maybe not so much for removing biofilm, but for adding that, getting that treatment refreshed through the lines as much as possible throughout the day. In between patients is key because of cross-contamination issues, but that also will help keeping the treatment flowing through the lines. The more we can do that, the better. Yeah. So it just takes effort. It takes work no matter what. Yeah. Yeah.
Yeah, I like the clarity of expectation there. It's not just going to be like a one and done easy thing.
Yeah. But and we kind of like that, right? We all are searching for that.
We want that.
It's just not the case with Waterlines. It's just not.
I like that expectation because I think that sets up going into this with the right approaching it correctly. And then I think, but it does get easier.
It does.
Over repetition, and you find ways to do this more effectively and things like this. I know with Waterlines, a lot of the conversation is often around the patient being exposed to potentially harmful pathogenic bacteria because of like a really robust biofilm. Yeah. The more that we've kind of studied this area of infection control, the more we've also learned about the idea of aerosols and actually potential harm to the dental clinician, which is shocking. Tell me a little bit about what we know there.
Man, so they did so many studies during COVID and like right after COVID because they thought that dental professionals were in a heightened risk because of COVID, right? Because they're really close to the patient right here. And so they were doing a lot of studies on aerosols and things that were in the room. And what they were finding was all this waterborne bacteria, pathogenic bacteria, the Pseudomonas, Legionella, Mycobacterium. And it's like, oh my goodness, this is from the water lines. It's not from the patient. Yeah. And so, then there's been a lot of other studies like on asthma with breathing in the aerosols and things like that. It's so crazy. There's been dental professionals that have gotten Mycobacterium pneumonia because of breathing in those aerosols. And so it's getting more and more to the light. I know the OSHA in 3 different states has cited under general duty clause because of aerosols. I don't know the whole story, but I know that a dental professional got sick or complained in some way. OSHA came in and they were able to cite under that because it is a recognized hazard,
Okay.
because people have gotten sick in the past.
Yeah. I think that's just so important too. It's like, yeah, we want to take care of the patients.
Yeah.
That's huge. But it's also like, we want to take care of ourselves as like dental clinicians. Like that's super important too. And it goes both ways when it comes to waterline maintenance and the possibility of aerosols. And so ensuring that it's getting done is really, really important, which is kind of actually how I want to wrap our conversation up today, which is this idea of an infection control coordinator really being the rock and the foundation to making sure this actually gets done in the way it's supposed to consistently. That sounds like such an important role.
Such an important role.
Could you help me understand, and us as the listeners, just understand what is that role? Who is typically assigned that role? And what do they need to be really great at this?
Yeah, offices that assign an infection control coordinator just do so much better. And really you're investing in, and usually it's a dental assistant, sometimes hygienist, but maybe the lead assistant that really takes on this role as their baby. They take on all of like the OSHA or infection control activities in the office, and then they really will own waterline maintenance and testing. And so they're the ones that are calling in. They're the ones that are really focused on it, making sure things get done.
Yeah.
But they really want to learn. They're eager to learn, eager to make sure things are getting done. And they really take it upon themselves. Like if they have a failed test result, they're like, oh my gosh, what do I do?
Yeah.
And so they reach out because they really truly care, not just about their patients, but about the reputation of their practice. They want to make sure that they have safe water, and they don't want to let anyone down. And so they really take that on. And offices that assign an infection control coordinator just do so much better. Not that everybody doesn't need to participate in making sure that things get done throughout the day, but just having that lead in the office is key. And then they can just really learn so much more. I love working with infection control coordinators.
Yeah.
They're so awesome.
Yeah.
And they are so eager to do things right and to get it down. And they take it so personally, though, when something happens, but personally in a good way where we just want to do the right thing. We just want to make sure we're safe.
That's so great.
Yeah, it's really cool.